The American healthcare system is broken, and it's not because of the dedicated doctors and nurses working tirelessly to help patients. Like millions of Americans, you've probably gone to the doctor only to be told that your insurance won't cover the treatment you need, or the visit to the office. Or maybe you've picked up a prescription, shocked by the high price, even though you have the best insurance. But here's the kicker. It's not the doctor's fault. They're just as fed up with the system as you are. The real villains are the insurance companies, pharmacy benefit managers, and the dreaded prior authorizations that have created a labyrinth of red tape with their malicious agendas. If these words all sound like mumbo jumbo, well, that's kind of the point. And who am I to explain what these are to you? My name is Dr. Sulman Aziz Mirza, triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And dealing with all these bad is ultimately going to make me stop practicing medicine. So, what exactly is the role of insurance companies in this whole healthcare debacle? Well, at their core, insurance companies are supposed to help us pay for medical care. We pay them premiums, and in return, they cover a portion of our healthcare costs. Sounds simple enough, right? But here's where things start to get messy. Insurance companies don't just hand out money willy-nilly. They have a whole slew of tactics they use to keep their costs down and their profits up. One of the biggest ways they do this is by setting policy prices sky high. They'll charge you an arm and a leg for coverage, making it hard for many folks to afford the care that they need. And even if you can afford the premiums, that doesn't mean you're in the clear. Insurance companies love to put limits on what they'll cover. They might say they won't pay for certain treatments or medications, leaving you to foot the bill. Or they might set ridiculously high deductibles, meaning you have to pay a ton out of pocket before they'll even think about chipping in. These sneaky tactics don't just hurt patients either. They make life a nightmare for healthcare providers too. Doctors and nurses often have to jump through hoops to get insurance companies to approve treatments for their patients. They spend hours on the phone, arguing with insurance reps and filling out piles of paperwork. All that time and energy could be spent actually taking care of patients, but instead, it's wasted navigating the insurance maze. Let's say you have a chronic condition that requires a specific medication. You've been taking it for years and it's the only thing that helps manage your symptoms. But then, out of the blue, your insurance company decides that they won't cover that medication anymore. They want you to switch to a cheaper alternative, even if it doesn't work as well for you. Suddenly, you're left scrambling, trying to figure out how to pay for the medication you need, or if you'll have to settle for a less effective treatment. Or maybe you need a surgery to fix a serious problem. Your doctor says it's necessary, but your insurance company disagrees. They say it's not covered under your plan, or that you need to try other treatments first, even if those treatments have already failed. So, you're stuck in limbo, dealing with pain or other symptoms while you fight with your insurance company to get the care you need. Now, ready to hear about my nemesis in life, prior authorizations? What exactly is a prior authorization? It's a fancy term that basically means that your doctor has to ask permission from your insurance company before they can give you certain treatments or medications. Here's how it's supposed to work. Your doctor thinks you need a specific test, procedure, or medication. But before they can go ahead with it, they have to fill out a bunch of paperwork and send it off to your insurance company. The insurance company then looks it over and decides whether they think it's necessary or not. If they give the thumbs up, you're good to go. But if they say no, you're out of luck. The idea behind prior authorizations is to keep healthcare costs down. Insurance companies don't want to pay for treatments that aren't needed or that cost a ton of money. By making doctors jump through these hoops, they can weed out the stuff that they don't think is necessary. But here's the problem. Prior authorizations can really mess with your care. Let's say you need a medication to manage a serious health condition. Your doctor knows it's the best option for you, but your insurance company says, nope, we won't cover it. Now you're stuck trying to find an alternative that might not work as well, or figure out how to pay for the drug out of your own pocket. Even when an insurance company does approve a treatment, the prior authorization process can still cause big delays. It can take days or even weeks to get a response, and in the meantime, you're left waiting and wondering. If you have a serious health issue, those delays can be really dangerous. Imagine needing a surgery to fix a life-threatening problem. Your doctor says you need it ASAP, but your insurance company drags their feet on the prior authorization. Every day that goes by is another day that you're at risk of complications or worse. So yeah, prior authorizations are a real thorn in the side of American healthcare. They put up roadblocks between patients and the care that they need and make doctors' lives a lot harder than they need to be. When we're talking about prior authorizations, you might assume that someone with the same qualifications as your doctor is making these healthcare approvals or denials for the insurance company, right? Right? Oh boy, just when you thought the healthcare system couldn't get any more tangled, we've got another knot to untangle. Peer reviews. Now, peer reviews sound pretty official and important, don't they? It's like having a bunch of experts double check that your treatment is up to snuff. Here's how it's supposed to go down. When your doctor wants to give you a certain treatment or procedure, they might have to send their plan over to a group of other doctors with the same qualifications for a once-over. These docs look at your case and then decide if the treatment makes sense for you. They're supposed to be the quality control, making sure you're not getting anything unnecessary or dangerous. But here's the thing. Peer reviews can be a real mixed bag. Sometimes they catch potential problems and keep you safe. But other times they just gum up the works and make it harder for you to get the care that you need. Let's say you need a surgery and your doctor is raring to go. But then the peer review crew steps in and says, hold up, we're not so sure about this. They might want more tests or a different approach. Meanwhile, you're stuck waiting, maybe even in pain, while they hash it out. And as often has been the case with some of my own patients' experiences getting prior authorization through a peer review, the other doc making the decision does not share the same qualifications as I do, and in some cases isn't even a doctor at all, or not even the same specialty. I can never forget the time that a patient's ADHD medication that they had been stable on for years was denied authorization by a surgeon. A surgeon! Like a lot of things in American healthcare, peer reviews are a bit of a double-edged sword. When they work well, they can be a helpful safeguard. But when they don't, they can feel like just another barrier between you and the treatment that you need. And as if insurance companies and peer reviews weren't enough to make your head really spin, there's another player lurking in the shadows of the healthcare system. They go by the name of pharmacy benefit managers, or PBMs for short. What exactly do these mysterious middlemen do, and how do they fit into the outrageous world of American healthcare costs? PBMs are like the secret agents of the healthcare world. They work in the background, negotiating deals between drug companies, pharmacies, and insurance plans. Their job is to figure out which drugs get covered and how much they cost. Sounds helpful, right? Well, not always. PBMs have been caught in some pretty shady dealings. For one, they pocket the savings that they negotiate instead of passing them on to patients. It's called spread pricing, and it means PBMs charge insurance companies more for drugs than what they actually pay the pharmacies. The PBMs then keep that extra cash. Another trick up their sleeves? Rebates. PBMs demand big discounts from drug makers, but they don't always share those savings with patients or insurers. Instead, they use the rebates to pad their own bottom line. These sneaky tactics drive up drug prices for everyone. Patients end up paying more at the pharmacy counter, and insurance premiums go up to cover the higher costs. Meanwhile, PBMs are laughing all the way to the bank. It's a big reason why American drug prices are so much higher than in other countries. We're not just paying for the actual medicine, we're also lining the pockets of these middlemen. People are starting to wise up to these schemes. Some states have passed laws to rein in PBMs, like banning spread pricing or requiring more transparency about rebates. There's even talk in Congress about cracking down on their shady practices. But PBMs are putting up a fight. They say they're actually helping keep costs down by negotiating hard with drug companies. And they've got a point. Sometimes their deals do end up saving money for insurers and patients. The problem is, there's no way to know for sure because PBMs are about as transparent as a brick wall. So, how do we fix this mess? Some folks say we need to cut out the middlemen altogether and have insurers deal directly with pharmacies. Others want to force PBMs to pass on all the rebates and discounts that they get. There's no easy answer, but one thing's for sure. Something's got to give. Because right now, it feels like we're all playing a rigged game. Insurance companies, PBMs, drug makers, they're all working angles and cutting deals, while patients are left holding the bag. It's no wonder American healthcare costs are spiraling out of control. From insurance companies pulling the strings to prior authorizations putting up roadblocks, peer reviews muddying the waters, and those sneaky pharmacy benefit managers, it's no wonder so many of us are left scratching our heads and reaching for our wallets when trying to get the healthcare that we deserve. It's a complex system, no doubt about it, but that doesn't mean we have to just sit back and take it. People are starting to wise up and demand change. Some states are cracking down on PBMs, while others are pushing for more transparency across the board. But real change is going to take all of us working together. We need to keep shining a light on these shady practices and holding the powers that be accountable. It won't be easy, but it's a fight worth fighting. If you learned something new, please make sure to like and subscribe to the channel. Drop your comments and thoughts below. If you do that enough, I'll finally be able to quit my day job, so I don't have to play this rigged game anymore. Until next time, be safe and be well.